whatever it is you're doing, you won't even see the result now. You might start to see the results in 2 years time, 3 years time, 4, even a decade after you've done all of that. So knowing that you're contributing to the advancement of medicine is, for me, is a big deal. Hello everyone and welcome back to my channel. My name is Okoyemi. So I've actually received loads of messages from nurses actually. So people messaging me are actually nurses, and the question has been relating to the advantages of being a clinical research nurse. So a few people have DM'd me to say, why would I recommend a research nursing role for them? Like, what are the benefits and of course the disadvantages of being a research nurse? And I have promised them to make a video to tackle that question. So let's just get right into the video. So from my experience so far being a research nurse in the last 9 months, I can actually categorically say that there are many benefits of being a research nurse, clinical one actually. So the first one in my perspective is the fact that you're contributing to medical knowledge, which is very, very key for me. I remember at my interview they asked me why research nursing, why did I want to become one? And I remember telling them that it's not just about me. I want to be part of medical advancements. I want to be part of the solution to people's problems, which in this case is finding treatment or finding a cure to a certain disease, in this case cancer, because I work in oncology. So the fact that I know that I'm contributing to whatever it is that would make medical professionals or experts finally find a cure to a certain disease was a critical one for me. So one thing I know that you would enjoy when you become a research nurse is the fact that you know that you are contributing your own quota to the development of drugs, treatment, and whatever it is that will make patients' life better in future. You're not doing it for the now. Whatever it is you're doing, you won't even see the result now. You might start to see the results in 2 years time, 3 years time, 4, even a decade after you've done all of that. So knowing that you're contributing to the advancement of medicine is, for me, is a big deal. Another thing I personally like about clinical research nursing, which I mentioned in the video I made about what we do as clinical research nurses, is the fact that we have varied responsibilities. Trust me, as a research nurse, you cannot be bored, because I know that people that want to leave the bedside, their major concern, or from people that have spoken to me, I have actually never worked in the bedside per se. I was a theatre nurse for the longest time before I came into clinical research. But for my friends that do bedside, one thing I know they talk about is the fact that they do pretty much the same thing day in, day out, every day, and it could be quite boring sometimes. And that's also one of the reasons why I never went into bedside nursing. That's why I went into theatre nursing at the first instance, because in theatres, your role is very, very dynamic. Even though you're for instance, I was a scrub nurse and sometimes I could be a circulating nurse, but with each procedure comes different outcomes and different ways of doing it. So that was one of the reasons why I enjoyed theatre nursing. And now that I'm into research, this is also something I love about research nursing, because it is very dynamic. Even though we have a protocol which is very stiff, the protocol is a protocol, you can't alter the protocol and you have to follow the protocol to the letter. Regardless, your role as a research nurse is very, very dynamic. It is very varied. The responsibilities are very varied, and I mentioned that in that video, which I will link up here for you guys. So you have different things you're doing part time, and your tasks are just very, very numerous, definitely, but they vary in dimensions, they just vary. So your responsibilities are very, very varied in the sense that your tasks are varied. It's like a mix of everything, a mix of patient care, a mix of administrative, role, a mix of a lot of other things, documentation and all of that. So I love the fact that it is varied in nature. So the third one is actually something I personally love about my job, and to be honest, this is something that my trust, the NHS I work for, that they are very, very big on. And the third point is actually learning. So research nursing is an avenue for you to learn new things. You keep learning, so there's continuous learning on the job. And I won't even lie to you, I'll be very, very honest, before I moved to clinical research, when I was still back in theatres, I have not had so much opportunity to learn the things I've learned now. now that I'm into research, we always go for different conferences. There are like numerous conferences to attend, workshops, seminars, trainings. Like there is no month, since I joined this department, there's actually no month that I do not have a conference to attend, or maybe a seminar, or maybe a training. There's just something, there's a form of learning for you to do, and it is not like the normal learning we do, like the mandatory training we do in the NHS. This is very, very different, and this is very like focused. This is like a focused learning, and it is just focused on research and everything that has to do with research. So I would say, as a clinical research nurse, you have several opportunities for continuous learning, and you will not find that in any other field. I'm just being honest. You won't really find that in every other field of nursing. In research, they are very, very big, on learning and of course learning. My next point is actually team collaboration, and obviously I've worked in several teams in the past. As a nurse, you really cannot avoid working as a team. Teamwork is like very essential to every job. But I would say that since I actually joined research, the way they work as a team is just fascinating. The role is very, very autonomous, which I'll come to later, but the teamwork or the team spirit is very, 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 it's very conspicuous. Like, it's not even something that can be hidden. It's very conspicuous that you need your team members for most of the things you do. As much as you're independent and you're doing your things yourself, you still need like your team members for most of the things you do. So team collaboration is very, very key in research nursing, and this is one of the benefits that you would enjoy. The next point, which I've actually touched on, is the autonomy that comes with being a research nurse. So you kind of own your own portfolio, and you have the trials in your own portfolio, which you supervise yourself. So that kind of autonomy, like you make, obviously, like I said, there's the part that you have to work as a team, right? So there's a team collaboration part of it, but there's also like the independence you get from handling your portfolio, managing your own trials. Obviously, you work with principal investigators like the doctors, you work with your colleagues as well, you work with the CTCs. Those are the trial coordinators. You work with a lot of other people, really. You work with other teams. You work with the laboratory, the pharmacy. Like, it is like a multidisciplinary approach. We know that. But again, besides all of that, you are actually very autonomous in your role. You make your own decisions, again, according to the protocol, really. But you're able to like make decisions for yourself. What's best for the patient, really. So I love the autonomy in this role, how you are managing your own portfolio yourself, and you get to do your things yourself. Obviously, in accordance to the protocol, and of course in the patient's best interest. So on benefits, this is the last one I'll be talking about, and that's the work-life balance. Again, this is something I particularly love about research nursing. I do 9 to 5 Mondays to Fridays, and this has been life-saving for me as a mom of a toddler. So if you are a mom, if you're a parent, and you're looking for a role that would let you have that work-life balance, where you can actually work on the weekdays, like where you can work weekdays and you can have the weekends to your family, get to spend time with your family during the weekends, then research nursing is the best one for you, really. So I do not work weekends, I do not do on-calls, I do not do night shifts, I just do day shift, which is 9 to 5 Mondays to Fridays. And honestly, it's been very, very good for me and for my family life at the minute. I've never liked shift duties, like say doing morning, night, on calls, because I've done this in the past, even as a theatre nurse, or being on call for like 24 hours. I've done this in the past, and it's not something I love. So if you really want like the work-life balance, you will actually find it in research nursing. Because in research nursing, we don't do unsociable hours. Like I said, we don't do Sundays, we don't do Saturdays, we don't do bank holidays. No, we don't work on bank holidays. Like, we don't do weekends, we don't do on-calls, we don't do nights. So you're not doing unsociable hours. Obviously, disadvantage to not doing all of that, which I will talk on later. So yeah, those are the many benefits of being a clinical research nurse. Now let's go to the disadvantages. Let's go to the cons. And the first one I'll mention is actually the fact that you're actually earning basic pay, especially if you work in the NHS. You all know that we NHS. You all know that if you work with the NHS, for every time you do unsociable hours like nights, weekends, bank holidays, on calls, and all of that, you get to be paid enhancement. So they call it enhancement pay, and you earn more whenever you do unsociable hours. But if you come into clinical research, there would not be anything like that. So you're actually going home with your basic pay. Yes. And because I've worked in theaters and I've had to earn unsociable hours pay, that's the enhancement. So I actually know that it's actually a big deal on top of your salary. So when you have all that money in addition to your basic pay, like the enhancement and pay, it is actually a lot of money, especially if you do lots of nights. I did lots of on calls and weekends as well. We used to do alternate weekends. It was basically Monday to Friday job, actually, even when I was in theaters, but we used to alternate Saturdays, which was for emergencies or trauma, because I was in orthopedics. My point is that when I get paid, you would see the amount you get paid just for enhancement, just by working, say, Saturday or Sunday, or even doing on-call. It is actually a lot of money by the time you add it to your basic pay. If you decide to do clinical research nursing, especially if your trust, if they don't do it, again, with clinical research nursing, you would have your own disease group, and then different trusts to have their own pattern of work, but in my trust we only do Mondays to Fridays, so you may have to lose the enhancement pay in quotes. So if that is not something you want to lose, or if, like, say, because of your family life right now you cannot afford to lose that money, if that money will make a lot of difference in your family life, then I would say research nursing is not for you. If you know that your basic pay will not be enough to sort your bills, then research nursing is definitely not it for you. The second one, which I know a few people have actually mentioned to me, is that in research nursing you would have limited patient interaction. I know some nurses cannot do without interacting with the patients. Like, that's what they love doing. I've heard people tell me that I can't do without seeing patients every day. Like, at the end of the day, when they finish their shift for the day, it gives them a sense of satisfaction and fulfillment, knowing that they've wiped patients' butts, they've fed patients, they've done all those other patient care, and that just gives them this sense of fulfillment. So if you know that the kind of person you are, then research nursing is not for you, because you would not have to wipe up a patient, you would not have to dress up a patient, groom a patient, you would not have to change bed sheets, bed linens, and all of that. You won't have to do all of that, and there's limited patient interaction. Like in my situation, our clinic days are on Wednesdays, and so we only see patients in clinic on Wednesdays, and then I do Mondays to Fridays. So which means that Mondays, Tuesdays, Thursdays, and Fridays, I do not get to see patients. I only see patients on Wednesdays, and a bit of, say, Thursday mornings, I also see patients, but that's just to hand them over for treatment. So Wednesdays, when I see like patients in clinic, Thursdays, I see them just for a bit, and that is just to hand them over for treatment. So I have like very, very limited interactions with patients. So that could be like a con for someone. For me, it is not, because I love the fact that I don't have too much patient interaction, and that means that for me, on Wednesdays when I see my patients in clinic, I'm able to give them my all. So because I've not seen them for this prior to that day, I give them my all, my attention. I'm like the best nurse for them for that day, because I've not been like overwhelmed with their presence, if you get what I mean. So it might work for some people, and it might not work for some people. For me, I love the limited patient interaction, but for some people, and I know because some people have told me that if they've not cleaned up a patient, they don't feel fulfilled as a nurse. So this role or this specialty will not be for you if you're that kind of a nurse that likes, having a lot of patient interactions. My next point is actually administrative burden. And so if you're a nurse and you do not like too much of, like, say, documentation, doing like the admin role, yes, some nurses do not like being like administrative. They don't like that kind of having to document, having to send emails, having to chase some information or chase some data, having to do all of that. Some nurses do not like that. And if you're contemplating switching to research nursing, then that might not be the case for you, because in research nursing, we do a lot of administrative job. Like, we do a lot of data management, we do a lot of documentation, we do a lot of queries, we send lots of emails. Honestly, sending emails is like the major mode of communication in research, really. We send lots of emails, we do a lot of meetings on Zoom, on Teams, actually a lot on Teams. We use a lot of spreadsheets, like a lot of spreadsheets. So you don't have to be like extremely techy. So don't get me wrong, it's not like I'm like extremely techy in nature, but obviously I love tech. Like, you should have like basic knowledge of Microsoft Office, and I mean Word, I mean Excel, I mean PowerPoint and the likes. So yeah, and if you really do not like documentations, papers, even though we do we do most of our documentation online, like using different softwares. We still do a lot of paper documentation as well. So if you're not that type of person, if you don't like the administrative burden that research brings, then research nursing is not for you. So the last one I will talk about in terms of the cons of being a research nurse is the work schedule. So as much as I love the fact that I get the work-life balance from working 9 to 5 Mondays to Fridays, I know some nurses just like the shift work. They like to say work for 3 long days and then have 4 days to themselves. Like that makes them more productive. So if that's what you like, then please don't come into research nursing, because at least in my trust we do Mondays to Fridays and you only have 2 days of duty, which is Saturday and Sundays, and of course bank holidays. So someone was just telling me recently that she actually went to a 9 to 5 role as a nurse, not research, but she took up a 9 to 5 nursing role, and after a while she had to leave it for a permanent night nurse role because that was suitable for her family life. She had kids that she would need to do school runs for her kids. It was a lot, so she had to like switch from a 9 to 5 nursing role to like shift pattern. So if you're someone that your present family life will not accommodate a 9 to 5, because it also means that you spend a lot more on childcare, because if you have like young children who are not yet in like primary school, you'd have to like pay more as regards childcare because you're working 9 to 5 basically. Whereas if you're like doing like long days, say 3 days a week, you know that your childcare needs to just be for those 3 days, and then the rest of the 4 days of the week you'll be home with your children. So again, like I said, the shift pattern may work for some people and it may not work for some other people. I love it and I enjoy it. So yeah, I think for now those are the pros and cons that I have experienced, as a research nurse. And like I said, I've only been a research nurse for 9 months now. There may be more than this, but again, as I spend more time being a research nurse, I'll come up with more benefits, and then I'll share all of that with you. So please, if you have other questions relating to clinical research nursing, let me know. I know a lot of you have reached out to me on Instagram and even on YouTube, but basically Instagram, asking me about this specialty. If you have more questions, please do not hesitate to send them my way, and I'll be making a video just to answer all of those questions. So thank you so much guys for watching, and please stay tuned for more videos from me and of course more vlogs. And if you had subscribed, make sure you subscribe to this channel, click the bell just so you're notified whenever I put up videos on this channel. And you want to send this video to your friends who want like a 9 to 5 job as nurses, send them this video and share with them. Let them also learn from this video. And yeah, I'll see you in another video. Bye.